We published this study because we wanted to tell people what was the right way of assessing myasthenia gravis after a consensus. So we did a literature search, we produced statements, those statements were voted by the scientific community, and we ended up showing that the MG-ADL should be the standard when assessing MG patients, and that should be performed on a weekly basis. Now, I know that this is very difficult to do in clinical practice if you have huge number of patients, but thanks to MG-ADL apps, which will be available in the nearest future, we will be able to follow up patients remotely without having phone calls or patients coming in person or filling in paper forms and then handing them back to the center. So we will be able to collect that in an automated way. And what about the QMG? So QMG is very important because it is an objective measure. And as I said before, if you think about comparing treatments, you might be able to see differences at a QMG that you were not seeing at the MG-ADL. So being an objective scale, we thought we should do the QMG once we start a new therapy or at therapeutic switches, or if patients are getting worse at the MG-ADL. That's the point where we should measure it with the QMG. Also, quality of life measures are important. Patient satisfaction questions are also very important. And why is this so crucial for MG? Because the impact, the burden of the pathology is huge. Many patients have depression, many patients have anxiety, many patients are not able to work and have very low quality of life levels. So it is mandatory in an MG center not only to assess the disease with MG-ADL and QMG, but once in a while as possible, that should also be assessed with the EQ5D, which is a quality of life measure, or with psychiatric scales measuring depression or measuring anxiety. This is mandatory because most of our patients are depressed and are anxious. Unfortunately, there we don't have MG-specific scales for these comorbidities, but at least using what is already available for psychiatric comorbidity is already a good starting point.